Hi, good afternoon, everyone. Yeah, today my topic is on cardiovascular disease and then see how Ganoderma can actually help in protection to the heart. Yeah, next, as usual, we have our disclaimer. So all the information that we have in this slide are intended for general health information and educational purposes. So are not intended to be used as a substitute for professional medical advice, treatment, or care. Okay. Yeah, first we look at the circulatory system. So the circulatory system consists of the heart, blood, and blood vessel, which actually carry the essential nutrients, hormones to the cell, and remove also at the same time remove waste product like CO2. So now we talk about the heart. Okay, one of the component is a muscular organ that actually pump blood through blood vessel of in the circulatory system. So they have blood actually carry oxygen, nutrient, and remove metabolic waste. So the heart itself have four chambers, right, and left atrium, right and left ventricle. So the blood flow through the chambers is in one direction, okay, controlled by the valve. And last one is the heart is supplied by the coronary circulation. So first we look at the circulatory system is also known as the cardiovascular system. And it's a complex network of organs, vessels, and tissue that actually work together to actually transport oxygen, nutrient, and hormones and other essential substances throughout the body. And it consists of, just now we mentioned about the three components, heart, blood vessel, and the blood. And the heart is a vital organ and is a muscular organ that actually pump blood, like a transport system that actually pump the blood throughout the body and delivering the so-called essential nutrient oxygen to the body cells. And the heart is actually located in the chest cavity between the lungs and above the diaphragm. So it is roughly the size of the fist and weight about 250 to 350 grams. So just now I mentioned about the heart actually made out of four chambers, the right atrium, the right ventricle, and the other left chamber will be left atrium and the left ventricle. So the upper chamber of the heart we call atrium, the bottom chamber of the heart we call ventricles. So actually blood always enter from upper chambers before going to the bottom chamber. So there's a left and right. So what's the difference? The right side of the heart actually pump oxygen, pour less oxygen blood return from the body to the lung. So they actually return from the body with less oxygen, actually go through the chamber and then flow from the heart itself, it pump from there to the lung. And then from the lung there, it receive more oxygen and actually pump back to the heart. Okay, so the oxygen reach more oxygen blood will actually flow from the lung and then pump it to the left side of the heart. So they will enter to a chamber, they will actually pass through the chamber controlled by the valve in one direction. And then you go to a bottom chamber and release out and supply to the rest of the body. So in summary, the blood flow in one direction through the heart with the control of the valve internally. So the right side of the heart deal with the blood with less oxygen as they actually return from the body. As the left side of the heart deal with blood actually with more oxygen that supply to the body. So the heart need to continues working, keep pumping and through the circulatory system so that our body will get enough oxygen and nutrients. Yep. So next. Okay, heart disease. So heart disease actually can come from three areas. First is a genetic, Second is a coronary artery disease, or the medication that you are taking. So first we talk about genetic. So genetic is those heart muscle wall problem. There's a hole in the heart or weak valves. Okay, so these are the heart abnormalities that are present at birth, which you have no control. So it can actually range from mild to severe condition. Yeah. So next will be CAD, coronary artery disease. So this happens when a major blood vessel, okay, that supply to your heart actually become damaged or having a disease caused by cholesterol containing deposit, because the fat deposit actually stay there and become plaque in your coronary artery, or it had inflammation. So when there is buildup of plaque, okay, arteries can become narrow. So the artery become the passage actually that allow the blood to flow will be lesser. So eventually with a narrow artery can actually lead to chest pain, shortness of breath, or even heart attack, because the body cell need oxygen, you can't provide because of a less so-called blood flow through. When less blood flow through, you can't carry much of the so-called oxygen for the body needs, and the heart keep pumping. That's why it can actually lead. Next, we look at some statistics. So you look at this table, okay, ischemic heart disease, okay, the first one. They actually, you can look at the data, it's actually in a growing trend from 18.5, actually it's not coming down, but it's growing up 18.8. And every day there are 18 people die from cardiovascular disease, heart disease and stroke in Singapore. So these are data back in 2019. And cardiovascular disease actually accounted for 29.8% of all death in 2019. Yeah. So that means that actually equate to about 1 out of 3 deaths in Singapore is due to heart disease or stroke. Yeah. So this one is the data is actually, you can tell that it's actually in a going trend. Okay, it's coming up. Yeah. So let me talk a bit about, okay, ischemic heart disease is also known as coronary artery disease. So it's a condition that actually occur when there is a reduced blood supply to the heart muscle, okay, to the heart muscle, due to narrow and blocked coronary arteries. So you see the heart muscle is also a so-called tissue cell. They also need oxygen, nutrients. So there is also a supply to them. So the coronary artery are responsible for supplying oxygen-rich blood to the heart muscle tissue. So when these arteries become narrow, okay, when the supply channel become narrow or even blocked, the heart muscle does not receive enough blood and oxygen. So that's where it lead to chest pain. And shortness of breath is that not enough oxygen to actually pump throughout the system, yeah, through the circulatory system, okay, because of the blockage and the narrowing passage of blood that can pass through. And potentially this will actually cause life-threatening, and that's why we get heart attack. Yeah. Yeah. Next. Next, we look at the symptom, complication, and the causes of this CAD. So the symptom will be, just now we mentioned, chest pain. You can feel pressure and tightness in your chest. And the other one will be, symptom will be the shortness of breath, and heart can't pump enough blood to meet the body needs. Yeah. So the heart, the body need a lot of oxygen and nutrients, but the problem is you can't supply enough. So the heart need to work harder. But when you work harder, they also can't get enough oxygen. That's where you get shortness of breath and you get chest pain. And eventually, if there's a complete block coronary artery, the sign of crushing pressure in the chest and pain in the shoulder or arm. So it becomes so severe that now it becomes heart attack. Yeah. So next, talk about the complication with all these symptoms. Next, we see obviously heart attack when there's a complete blockage of a coronary artery, and the other one will be heart failure. So when heart attack happen, heart become too weak, okay, to pump enough blood to meet the body needs. Yeah. So at normal heart rhythm, so this one is a irregular heartbeat. Okay. So this one is that the complication, you will end up with this so-called irregular heartbeat and inadequate blood supply to the heart, or there's a heart damaged heart tissue interfere with the heart electrical pulse, so causing the so-called intermittent kind of heart rate at normal heart rhythm. Yeah. So the causes, yeah. Now look at the causes. So causes is actually begin with the damage or injury to the inner layer of the artery. So the damage may be caused by various factors, including smoking, yeah, three highs, high blood pressure, high cholesterol, and diabetes or insulin resistance. So three highs are because of all the so-called the blood circulation, including the blood circulation and so-called the fat deposit actually stay in the area because of blood circulation, poor blood circulation, and all this, it becomes thicker, and then it become a plaque in the channel. Yeah. So the other one will be the cause is not being active. So your lifestyle become not active. So you are not active. So blood circulation will be a problem, and with all these complications came in. So yeah, so we will have all these heart disease. Yeah. So you will have high chance of getting this heart disease. Okay. Now we look at the prevention. Okay, for prevention, of course, healthy lifestyle does help. Okay, lower your risk of getting heart disease. And first, if you are a smoker, you probably need to quit smoking and control the so-called health conditions, such as if you have the illnesses such as high blood pressure, high cholesterol, and diabetes. And at the same time, to stay healthy, stay physically healthy. So eat low fat, low salt diet that rich in fruit and vegetable and whole grain. So low salt diet and healthy diet, this will actually help. For example, low salt, if you have high salt in the body, you will have water retention. So water retention will actually cause burden to your so-called blood pressure. Yeah. So if you are not physically active, okay, all the sodium will stay in the body, and the water retention will actually cause burden to the rest of the um, blood pressure, cholesterol problem. Yeah. And next, maintain a healthy weight. And lastly will be the reduce and manage stress. Yeah. Yeah. Now we look at the diagnosis of CAD. First, we have the ECG. So basically, ECG is to actually record electrical signal as they actually travel through your heart. So what it means is actually there's a they actually equipment to actually read the electrical signal as they travel through your heart. It actually mainly record how often the heart beats, okay, such as heart rate and how regular it beats, okay, the rhythm. So you can give the doctor the important information, for example, how possible the narrow of the coronary arteries, heart attack or irregular heartbeat, like the artery fibration. Yeah. So next, we is a cardiac stress test. So this one is detect the sign and symptom that occur during exercise. So they will actually stress the heart by letting you doing some exercise. So so that usually involve walking, on a treadmill or riding a stationary bike, and with all the devices hooked up to your body to actually read the signal. So they'll be watching your heart rhythm, blood pressure, and breathing during the test. But for those people who can't exercise, they may be given a medicine that actually create the kind of effect of exercise. So they can actually measure. Next will be the ultrasound test. Okay, they will actually ultrasound test. It just produce the image of your heart, and it's scan image to look at the heart and the nearby blood vessel. Next will be looking at the cardiac, the cardiac catheterization and angiogram. So this one is an invasive type of a diagnostic procedure. So they will actually have a catheter inserted into the artery or vein, okay, in your groin, so that they actually, there's a small little so-called device that actually go into your so-called the vessel, the blood vessel, and then to the heart, and then do a balloon from there to actually improve the so-called the blood flow. Yeah. Next will be the cardiac CT scan. So this cardiac CT scan is also a scan image of the heart and its blood vessel, okay, using a CT scanner. So to what they are looking for is to look for the so-called any calcium deposit in the arteries. Yep. Okay, next. Next, we will look at Ganoderma or Lingzi. So Ganoderma, also known as Lingzi, is a very special type of mushroom that has the healing property, and it has been recognized as a medicinal mushroom for over 2,000 years. And its powerful effect have been documented in the two oldest ancient medical books in ancient China, 神农本草经 and 本草纲目. So in the last 50 years of modern scientific research in Lingzi, we can find many evidence-based reports published. Later, I'll share with you some of them. So if you do a Google search, okay, the keyword Lingzi or Ganoderma and diseases, you can easily get more than 1,000 search results, okay, showing all the research paper published. And almost all the report can be found in the so-called PubMed database website, which is the US National Library of Medicine. Yeah. So yeah, next. So when it comes to selecting a Lingzi product, you will be actually spoiled for choice in the market. So why would you choose Zhuanghe? First, Zhuanghe is one of the world leaders in producing top quality Lingzi, and their main core business is in researching, producing, and marketing of Lingzi. So the company has been in the business for 32 years, specialized in producing top grade Lingzi product. Head office in Taiwan and named as Double Crane. In this Southeast Asia region is named as Zhuanghe. So the company owned their in-house R&D Lingzi farm back in Taiwan, as well as the distribution worldwide network. So throughout many years of research effort with its patented extraction processes, all Lingzi products are actually extracted with the two unique components, terpenoid and micromolecule polysaccharide content. So these are very unique content ingredient. Yeah. And the product have been scientifically certified with various endorsements around the region. Singapore HSS, TQF, Taiwan Quality Food, Halal certified, as well as ISO. Yeah. Next. We'll look at the function and benefit in heart protection. So first, there's a Lingzi can actually help in regulating our immune system. So with that, it actually can control and prevent inflammation. So it actually helps to prevent inflammation in the coronary artery. As you can see, the immune system need to be balanced. It's not to be on one side. So if it's on Th2 is greater than Th1, then you will have an allergy, example. Yeah. So Linzer is able to regulate our immune system. And second is improve blood circulation. So prevent high blood sugar, high blood pressure, high cholesterol, and potentially this prevention can actually, if you don't, if not, these three high can actually potentially lead to CAD. Yeah. So it does help improve blood flow and vessel elasticity. So high blood glucose level, example, with and high cholesterol, all this can actually cause fatty deposit to form inside the blood vessel. So over time, this deposit may actually make your blood vessel narrow. Okay, with high cholesterol, eventually blood pressure may actually go up. So hence the blood circulation is very important. It can actually prevent this whole so-called three highs. Yeah. So Lingzi is good in that. Next. Yeah. So the third benefit, okay, is that Lingzi can enhance liver function, especially in the detoxification area. So healthy liver actually create immune system that fight against inflammation. So the liver actually remove need, okay, the liver function, liver have many functions. Okay, one of the major critical functions is that they have to remove toxin from the blood. Okay, so what they do is they actually break down into a water soluble form, and then dump it into the gut, where the large intestine will actually filter them and then pass out of the body. So liver supposed to do this function to break down the toxin, remove the toxin from the blood. And the liver is also a key frontline immune system. Ideally, actually they actually position to detect pathogens entering the body via the gut. So the liver appear actually to detect and capture and so-called clear the bacteria and viruses and micromolecules. So liver function will be very important, yeah, in this aspect. The fourth is to remove, Linzer can actually help to remove free radical and oxidation. So it will actually reduce the free radical. So free radical, okay, will actually attack, okay, will actually damage our cell. So Linzer can actually help to reduce free radical so that it can actually also help to reduce the so-called the damage on the blood vessel wall. Next. Yeah. The next few slides will be focusing on the research of the Ganoderma in protecting the heart. So the research of using Ganoderma on direct protection on myocardia. And myocardia is actually muscle tissue of the heart. Yeah. So the very first test the researcher want to know is to see, before they go further on any test for this, they actually want to know if Ganoderma is toxic, okay, to the heart muscle or not. Okay, so because they know that most of the drugs that are effective on certain treatment of disease may have some form of toxicity to the heart muscle tissue or to the cell tissue. So what they did is they tested on two groups of healthy mice, one fed with Ganoderma and the other one without. And after 1 week of feeding the Ganoderma, they analyzed the heart tissue on both groups. They found no damage at all. So, so the result confirmed that there's non-toxic to the heart, okay, for Ganoderma. And second test is about the Ganoderma on heart muscle damage. Okay, so they actually inject the isoproteronol, a kind of drug, to the mice. They actually do whatever they do. This is they want to stimulate the heart muscle injury. They're actually similar to the kind of work-related overloaded kind of damage. So this drug will actually, what this drug do is that this drug will actually increase the heart rate. Okay, when you inject, they will actually stimulate and cause the heart rate to increase. So they split the groups of mice into two groups, and one fed with Ganoderma and one without. So after 5 days, okay, mice fed with without Ganoderma, okay, without Ganoderma, they show heart muscle cell damage, okay, and the damage is similar to the cell death and fibrosis. So and they don't see any damage, okay, on the group that having the so-called Ganoderma. So the test proved that Ganoderma is able to protect the heart muscle. Yeah. Next. So next is another test also on Ganoderma on heart muscle protection. So before going to that, a bit of background of this test. Okay, according to a study, our body cell can regenerate and replace with new cell by itself. Okay, for example, our body takes about 4 months, okay, to complete the cell renewal for red blood cell. Yeah. So for heart muscle, it's about 1% per year when we are young for renewal. 1% of the cell that actually renew, okay, per year when we are young. The older we get, the renewal rate, okay, will be lower. Example, when you reach age 70, the renewal rate, okay, will be around 0.4% for the heart muscle tissue cell. Yeah. So based on this 1% renewal rate every year, our heart muscle cell at the age 50, yeah, what it means is that based on 1% every year renewal cell, when you reach 50 years old, it means that you have 50% of the heart tissue are still in the old cell waiting to be replaced. Okay, but that is assuming the 50% need to replace one is without injury or damage in the heart muscle, okay, during our young age. Okay, so another thing is that if you have some damage in your heart tissue muscle, the muscle cell left to function at that time will be lesser. Okay, so when we grow older, you need to work harder. The heart muscle need to work harder because you have more cell die off. Okay, so as a heart cell die, it will be permanent. So once a heart muscle tissue cell is dead, that's it. It's permanent. It's not not reversible. Okay, so at the end of the day, it could be a burden to our heart as the renewal rate is getting lower and lower when we age. Yeah, so this is a background of the test. Okay, so this is a test on the mice, also on the so-called just now the drug ISO induced mice, but this round is different from the previous. This ISO induced this group of mouse now they use for the test is that they induce it with ISO, but they had already caused a 1% damage in the heart muscle. So this is the test on this group of mice. So they actually test it, same two groups, one with Ganoderma, one without. So the results show that the Ganoderma is able to protect the heart. Okay, the so-called the Ganoderma group, they actually show good result that they are able to protect the heart by preventing the cell death. Yeah. So so heart can still be function well without much burden. Yeah. So next.
Okay, we continue.
So next is the so-called test Ganoderma against oxidative stress to the heart. Yeah. So so the background is oxidative stress result in increasing in reactive oxygen species, increase free radical, and thus disrupt cellular signaling. And oxidative stress is also associated with the cardiac injury and many other diseases like cancer and aging. Okay, so so-called in summary, this so-called free radical, okay, from this oxidative stress are actually free radical in this sense is that they are unstable atom that can actually damage cell, causing many health problems. Yeah. So this test is done with the so-called staining, so-called heart muscle cell with hydrogen peroxide, H2O2. So this H2O, yeah. So before go that, a little bit on the background. So as our body cell need glucose, okay, as energy. So without glucose for a day, our cell will die. So when the heart is overburdened, other than oxidative stress, okay, will happen, and it will actually increase the oxidative stress because they are, and the energy needed by the heart, okay, is also increased. So if the heart muscle cell not getting their energy for one day, the cell will die. The heart muscle cell will die. So here the test is trying to test this, and the result came back. They actually found that the Ganoderma, they show that the heart muscle cell was still able to survive. Okay, when the tissue being deprived in from getting the energy they need. Okay, based on the two group, they also based on the two group. The group with the Ganoderma able to survive, the muscle cell able to survive because effect with Ganoderma. The other group, they don't show this. Yeah. So it actually so-called evidence show that the Ganoderma can actually able to protect, okay, myocardial. Yeah. Next. Oh, okay. So next test is about um, damage caused by retopermin. Okay, first background. Okay, a bit of background. Retopermin is a fat, is a feed additive to actually promote growth and leanness in animal. Okay, so may cause tachycardia, heart rate increase, and fast heartbeat above their fast heartbeat above 100 beat per minute, or you will have irregular heart rhythm and high artery blood pressure. But it has been approved for use on animal in US and Japan, but banned in 160 other countries, including Europe. For animals, they are 90%, okay, are actually discharged through urine. So 90% of all these retopermin they consume, okay, are actually discharged through urine after 1 hour of feeding. Yeah. So this will it will actually accumulate inside the body when okay for us for consumer when we eat it actually accumulate inside the body when our body it will actually inside our body accumulate if our body is not able to metabolize and pass out from the body. Yeah. So next. Yeah. Just now was the background. Now we look at what tests they have done. So they did in vitro test, which is the study done in a controlled environment such as a test tube or a dish. Yeah. So this in vitro test is done on the mice heart muscle cell. So first they found that when they increase the retopermin concentration and through longer period of time, the number of heart muscle cell die also increase. Okay, so you affect the heart muscle cell. So next they continue, they actually added the Ganoderma, gadoderic acid. They actually observed that the rate of cell death was able to control. So from there, they actually proved that Ganoderma, gadoderic acid can actually neutralize the potential toxicity of retopermin. So this test again proved that Ganoderma can actually protect the heart. Yeah. So now we look at in TCM perspective. Okay, what is the heart related to? So in TCM perspective, there are so-called 5 zhang and 6 fu, 6 fu. So if we look at 5 zhang 6 fu, the zhang organs are actually those are solid organ, and the fu one is more on the so-called the hollow organ. Example, the zhang referring to lung, spleen, liver, kidney, and heart. Okay, the 6 fu is referring to the just now we mentioned about hollow type of organ, gallbladder, stomach, small intestine, large intestine, bladder, and sanjiao. Okay, so yeah. So let's start with the first organ, heart. So the number. So so in TCM perspective, what food are good for the heart? So they believe that bitter food is better for the heart. And color, in terms of color, they found that red color type of food also better for the heart. Example, for vegetable, they have tomatoes, red pepper. As for fruit, they have red apple and red dates. Yeah. So this is in terms of TCM perspective. Next. Yeah. So as mentioned in the ancient book of in China, the 本草纲目, it has been documented that Ganoderma can actually relieve chest tightness as well as benefit hearts. So from all the scientific research, we can actually relate that to the efficacy of Ganoderma lucidum on cardiovascular disease, enhance cardiovascular function, clean the blood vessel, improve the blood flow. So the therapeutic to coronary heart disease, heart failure, and high blood pressure. Yeah. So this is based on the documented in Chinese. They say 主治胸中结，益心气. Yeah. Okay. Next. Next, we'll look at the so-called the Shangho quality supplement. For this, we have Yongken pollen, which has the essential nutrients that needed by the body, with more than 16 vitamin, more than 16 mineral, and 21 amino acid, and 28 nucleic acid, and more than 94 enzyme and coenzyme. So because they are most complete food on earth, they have many benefits. Example, regulate our nutritional imbalance, calm our nerve and relieve stress, which we need, and help in weight loss, and increase stamina and remove fatigue. Yeah, so fortify our immune defense. Okay, and the last one will be enhance absorption of 灵芝, meaning if you are taking 灵芝, it's good that you actually can go along with this bee pollen that actually help your body actually increase the stamina, also remove fatigue to provide more energy during the so-called consumption of 灵芝. Next. Yeah. Next, we have Jiaho fiber. It's also another quality supplement. It contains both soluble and non-soluble fiber. So soluble and non-soluble fiber have unique benefit. So as soluble fiber dissolve, it actually create a gel that may improve digestion in a number of ways. Okay, for soluble fiber may actually reduce your blood cholesterol and sugar. It helps your body to improve blood glucose control, which can aid in reducing your risk of diabetes. So for insoluble fiber, it actually attracts water into your stool, so making it softer and easy to pass with less strain on your bowel. So insoluble fiber can actually help to promote bowel health and irregularity. Okay, it also support insulin in sensitivity, and like soluble fiber may actually help to reduce the risk of getting diabetes. Yeah. So last is that this fiber can actually help in weight loss because due to its very low in calories. Yeah. Next. Yeah. So next we have Jaho. This is a protein powder. So this protein powder have been so-called awarded the so-called protein digestibility called PD. So in short, it called PDCAAS. Okay, the number is actually rated as 1. So this is the so-called the organization or the method of evaluating the quality of protein based on both the amino acid requirement uh, of human and their ability to digest it. So this score means after digestion of this protein, it actually provides per unit of protein 100% or more of a dispensable so-called amino acid required. Yeah, so it's fully absorbed by the body. Yeah. So this PDCAAS rating, so-called this rating was actually adopted by the US FDA and the Food so-called Agriculture Organization of a United Nations World Health Organization back in 1993. Yeah, and they have they found it they actually stated that this is a preferred best method to determine the protein quality. Yeah. So the ingredient we have is isolated soya protein, lecithin, and papain. So isolated soya protein, they can ensure that the body optimize intake of protein requirement and capable of subduing growth of tumor cell and preventing cancerous disease. So they have these unique features. And lecithin, they're actually able to reduce excessive fat in the blood vessel and the liver. So also encourage development. Yeah, it's also one of the so-called component that actually encourage the development growth of brain and prevent Alzheimer's disease. Yeah. So this lecithin can also result in help you in weight control. Yeah. The papain is a papaya enzyme. Yeah. So and bromelain is a pineapple enzyme. So these are the so-called the ingredient that actually aid in digestion and easy assimilation of protein for the body. So all in all, you look at all these quality ingredient in this product is actually needed by our body. So they actually can help us digest, absorb the protein in our body. Yeah, next. Next is CEO coffee. So this CEO coffee is made of natural ingredient, example such as the Arabica coffee bean, natural sugar cane, coconut milk, and our Ganoderma 灵芝. So long-term consumption would have the benefit of preventing type 2 diabetes, cut down the risk of liver cancer, able to elevate mental alertness, and also help in the control of your body weight. And the last one will be a diuretic benefit, which means that it can help to pass out the urine more frequently. Yeah. So next, we have the so-called the recommended dosage. So these are the so-called based on the past experience of all the so-called senior leader that actually these are the recommended dosage for the YK Ganoderma on 3 highs. So for prevention, okay, so it's 4 to 8 capsule of YK Ganoderma. Okay, for therapeutic pre-illness level, 12 capsule of YK Ganoderma and above, or 20 capsule of YK Ganoderma and above if there is damage that already have damages to the heart muscle. Yeah. So the last one will be therapeutic mega dose. So this one mainly for treatment. So this one supplement to a treatment. Yeah. So 30 capsule of YK Ganoderma and above, okay, involve heart attack or stroke. So this dosage is a recommended. There is a this so-called Ganoderma is safe for consumption. You can actually increase the dosage as you like. Yeah. So some people may have after consuming first time consuming the so-called Ganoderma, the 灵芝, some people may experience some vertical reaction. Yeah. First one may be hypertension. You may experience some slight increase in the blood pressure and or heaviness in the head. Or this is temporarily. It may actually last for 1-2 weeks. It depends on individual condition. Yeah. So second is a hyperlipidemia. So this is slightly increased in terms of cholesterol level. Yeah. So not all people will have it. Last one, for those people who are diabetes patient, they may actually see some slight increase for a while in the blood glucose or some swollen on the hand and legs. So not to be alarmed, this is temporary. So continue the dosage and this reaction may actually go up. Yeah, based on past experience. Yep. Now we look at the testimonial. So the first testimonial is a male, okay, Mr. Lee from Taiwan. At the age of 41 back then in 2017, he was a CEO of a listed technology company in Taiwan. Yeah. So has a high blood pressure around 150, 160 mmHg and metabolic and also have metabolic disorder. So one day, on the way home, he complained about severe headache, very heavy headache and dizziness. Yeah. So after a checkup, then we went for a checkup and discovered that one of his coronary arteries has a 50% blockage, but has yet to actually reach a point of requiring to insert the stent. So in such situation, myocardial infarction may occur. So this is the heart muscle. Yeah. So may occur suddenly if a breakaway blood clot. So this myocardial infarction is actually also in the term of what's called heart attack lah. Yeah. If a breakaway blood clot choke the coronary artery, 50%, then they will have a 50% chance of a surviving rate for the first timer. So he was given medication like aspirin to prevent the clotting, and the drugs also given the drugs for the high blood pressure. But as he had the stomach ulcer, so he did not actually take the aspirin because he got stomach ulcer, he got stomach problem. When he take the aspirin, he will actually have the so-called worry about internal bleeding. Yeah, so he didn't take. So, but he also constantly looking for so-called other alternative. Yeah, besides taking the so-called Western medication, he has been looking for. So out of chance that he actually chanced upon this so-called the Ganoderma, the 灵芝. So he started to take 12 to 15 灵芝 a day before meal and split over 3 times together with the so-called the Western medication. And half a year later, the his blood pressure actually came down to 120 and oblique 90 mmHg. And he also changed his so-called his lifestyle. He also start to actually maintain a health, trying to go back to healthy lifestyle. Prior to this, he had prior to this he had this problem. He actually stay up quite late because he's a CEO. He's so-called a bit of workaholic. He actually stay up very late because of so-called time zone difference in his so-called in his MNC company. He need to actually have a lot of meeting at night, okay, at night, and stay late for very long time. That's where he have all these health problem. So now he actually realized that he want to actually have a better health, better want to have control in his health problem. So he actually start to maintain a very healthy lifestyle. Okay, he actually start to maintain healthy lifestyle and now only consume 8 capsule of 灵芝 a day, and he's actually everything went back to so-called in a controlled manner and able to actually so-called slow down his work pace and everything back to normal. So his so-called blood pressure and so-called everything is under control after the 灵芝. Next. Next is also a testimonial from Taiwan, Mr. Liu, at the age of 57 back in 2017. So Mr. Liu is also so-called he's a vegetarian and he has been so-called practicing. His lifestyle is quite normal. It's not it's a good lifestyle, practicing good lifestyle, and weight 50 kilogram, and he suffer from so-called myocardial infarction, also something like so-called heart attack. Yeah. So mainly caused by so-called the decrease or complete cessation, complete blockage, so-called of the blood flow to a portion of the heart muscle. Yeah. So that's why it's something sort of like heart attack. So he encountered a near death experience. He so went to a hospital. So and then during the so-called the journey, they actually resuscitation. They did actually resuscitation, so-called 3 times during the CRP to actually bring him back. Okay, but he was hospitalized at that time. He was actually diagnosed with a so-called found that also have a irregular heartbeat. So due to the so-called the myocardial infection, so doctor actually immediate perform a balloon procedure in one of the main artery. So they did a cooling therapy, okay, for him, and to reduce the potential damage of the brain cell by free radical. Okay, so this cooling therapy is that they actually, when you have this so-called so-called problem like heart attack, when you they actually trying to bring down the temperature of your body. Okay, so when you bring down the purpose of bringing down the temperature of body to about 30 to 33 degree, to stay in the 33 degree, to actually let your brain, because let your brain and your so-called your heart won't have to work so hard to actually to get the oxygen for the brain. Yeah, so it can actually so-called actually slow down, so that you will not need, the heart won't have to pump so hard to get the oxygen for the brain. You still need the oxygen, but it won't be so-called the therapy is supposed to help in this area. Yeah. So the family started to feed him, okay, at that time 3 sachets of Ganoderma daily, okay, during that time when he's in ICU. Yeah. So after completed the cooling therapy at day 4, yeah, Ganoderma dose was actually increased to every 2 hours. So at that time he was still in a critical stage. The condition was also later at day 6 it get more or less stable. So when it's more or less stable, started to actually bypass some of the to bypass the operation. After the discharge from hospital, he actually constantly taking about 3 to 4 different type of Ganoderma product. Why 3 to 4 different types is because different concentration. They are actually at that time they are trying to have higher concentration of product to actually so-called let him take it for the treatment. So his health actually has come back to normal, and yeah, everything back to normal after, but he still continue with the so-called 灵芝 dosage. Yeah, next. Yeah. So come to a conclusion. So you know that myocardial infarction, so-called also known as a heart attack, actually can happen anytime, anywhere. If one choose to ignore the pre-illnesses symptom, so heart attack means that so-called the blood flow has been completely cut off. So this will result in cellular death. Yeah. So the second is that above disease can be prevented, okay, with the control of the balanced diet, the regular exercise, and also stress management, and also early medical treatment. So all these are very important factors that can help to prevent, lower your risk as well. So third is a Ganoderma is one of the best health food to prevent and also had the therapeutic effect on circulatory disease, but should not view it as a mainstream medicine for the circulatory disease. So lastly, other stronghold product, okay, we have a quality ingredient inside, such as bee pollen, fiber, protein, powder, and lactobacillus can be consumed as part of the so-called balanced diet formula. Yeah, with that, I end my presentation. Thank you.